My interest in Forum 2012 is to strengthen my networking and partnerships with different institutions, to scale up on improving the private sector provision for health. And specifically, I've been involved in the Youth in Motion sessions to provide this provides a forum and a platform for young people to be able to exchange ideas, identify key strengths, but also identify ways of how we can be involved in health provision without necessarily relying on aid. And this looks at the kind of skills that we have, that we're able to bring to the table. As young people, we are usually crazy, so we have a platform where we can articulate provocative ideas, and I'm hoping that this platform, Youth in Motion at Global Forum 2012, will provide an opportunity, and I think it has already done that. The responsibility of young generations, for starters, is how can we be involved in having our governments accountable. And it starts with a personal moral conduct among the young people. What kind of moral conduct do we have? I'll give a specific case of Uganda. We've had a high rate of corruption, and it goes back to the moral conduct that is instilled in us. And my presumption is that as young people, if we are able to change that attitude, then we have a responsibility to hold our governments accountable, starting with us. How accountable are we to the communities that we work with? How do we empower those communities we work with to be involved in the decision-making processes and also hold the government accountable? And I believe as young people we can facilitate that process. COHRED can assist young people in Uganda by, for starters, identifying key areas of research that young people can be involved in, so that they're given a wider perspective to be able to get involved in research from the onset, in identifying the key research problems pertaining within their communities. That's for starters. 2, strengthening their capacity to conduct research. It might not be hardcore research. Could be software kind of research where they identify basic issues within the communities. For instance, why don't women go to hospitals, or why don't young girls go to seek for reproductive health commodities from the nearest facility? It could be because the facility providers are not receptive towards them. And if a young person went to seek for a reproductive health commodity, you're looked at as being promiscuous. So if COHRED can involve young people by attaching them to small-scale research institutions that can, one, provide them with the strength, with the skills to improve their research capacities, then this can be followed with working within the available resources, because what we're talking about here is beyond aid. We don't want a case whereby we're told, okay, there are huge monies under the Bill Gates Foundation on child survival, can you lobby for this? But is child survival the biggest issue within my community? So if COHRED can provide that process where young people, one, are able to identify key issues within their communities and mitigate them from a lower level, then provide mentors. We have mentors back in Uganda. Today morning, reference was made to Uganda. We have one of the highest PhD holders. But I'll put it back to them. What have they done in mentoring young people? If they had to exit tomorrow, who would step in their shoes? And would love to see that process where there is mentorship, but also partnerships where there are exchange programs between the North, South, South, North Pole. And young people are able to come and learn from other institutions on how they're conducting or how they can be involved in the different processes. My understanding of beyond aid is the degree to which countries are able to run their economies without necessarily waiting for donor funding. And this can start with exploring the available resources. Let's take a case of Uganda. If you've read in the media recently, we have oil, and as a young person, my question is, how is that oil going to benefit the country? If we can create markets for that oil and be able to garner a certain portion of monetary benefit, then those monies can be used to supplement other budgets without necessarily waiting for donor aid. Over 70%, actually it's around 90% of the health budget in Uganda is funded by donors. Why should that be the case? And yet we have a whole oil sector that has not been exploited. Uganda naturally is supposed to be an agriculture-based country. But over the past years, agriculture does not reflect anywhere in contributing to the economy. Those are avenues that we need to exploit. How can we exploit our agriculture section such that we don't have young people waiting to go and sit in white-collar jobs, but actually exploit the agriculture sector for their own benefit? And that's where we have the governments, if the governments can go the extra mile and create markets. The markets do not have to be at a global level. They can start at a country level. But has our country facilitated that process? I don't see it. So these are basic things. Beyond aid starts with, it's not a blame game, but it starts with identifying the kind of resources that we have. If we do not have the technical expertise, partnerships can supplement that through providing that kind of technical expertise. Let's make toiling with our hands sexy than sitting in a white-collar job waiting for a paycheck at the end of the month. The project that I have worked on, a number of projects, the first being with young positives. These are young people living with HIV, and that's where we go back to talking about beyond aid. What kind of available resources do we have? I had a very interesting experience 2 years back. In addition to being a youth in motion, I'm an Emerging Voice. Emerging Voice is a mentorship program under the Institute of Tropical Medicine. And what Emerging Voice has done, or the Institute of Tropical Medicine in partnership with other stakeholders, identifies young people and they're mentored into becoming researchers. It starts at a low-level process of capacity building in scientific writing. So young people are given an opportunity to be able to articulate their issues, but in a more, I would call it, professional way. And I wrote an essay based on the needs of young people living with HIV, a case study being young people living with HIV in school. And how did this come up? I was working with Straight Talk organization. Straight Talk Foundation is an institution that works with young people. The focus has been on improving sexual and reproductive health for young people through educative materials. But over time, Straight Talk realized that they were actually not targeting young people living with HIV. And yet, these are young people who are grappling with living with HIV, being adolescents, transiting into adulthood, getting married, having partners, and the whole issue of sexuality is not being addressed. So the scenario that we're looking at is an increase. At some point in the Ugandan statistics, there was an increase of HIV among adolescents. And studies that had been conducted actually showed that there was cross-transmission. young people living with HIV getting into relationships with young people who are negative. And it's because that process has not been facilitated. So we're trying to convince my institution that we need to come up with interventions that are targeting young people living with HIV, but without discriminating them. And they told me, Victoria, that is impossible. It's going to take a lot of money. The only way we can work with these young people is by going to talk to them into the facilities. But then the facilities, the scenario in the facilities is they come on appointment. So you're not going to have time to interact with them. The majority of the time that they're interacting with people is either in their communities or at school. So how do we penetrate the communities or the schools without stigmatizing them? Anyway, to cut a story short, when I wrote that paper, it received, I was able to present it at the 2010 Global Health Systems Symposium in Montreal, and my boss thought, well, if this can be presented there, then it probably does make sense. So we wrote up a proposal to conduct a rapid needs assessment, identify the kind of interventions that are required. And as we speak, that proposal was funded by Makerere University School of Public Health, CDC, and we have a running program, an integrated program for young people living with HIV. And the approach is a peer-to-peer approach where we have school forums and we're able to interact with them without stigmatizing them, but also strengthening the systems within the communities to support these young people. And I'm hoping this can be scaled up on a large scale.